We have been told that we are fighting against triple threat. The first being the fight against new infections. And it's reported, and I think we must take it with a degree of appreciation, although there's a lot of work to be done, that the rate of infection has gone down from 24% or thereabouts to 14%. It is our aim, ambition, and goal not only to achieve a single-digit prevalence rate, the prevalence rate of AIDS, or even get to zero, as some of the speakers have spoken. I think it is achievable. It is achievable. Those three threats, and I've said and I've talked about, the first one is new infections. The second one is teenage pregnancies, which again was the theme of one of the presentations that entertained us today. And the third is to fight against and eliminate sexual or gender-based violence, sexual violence. And I'm hoping that, this sensitization that has been undertaken in Bondo today will go a long way in fighting against this scourge of AIDS in the country. And we have to be very careful, because we don't just have the problem of AIDS, infections, and the spread of the virus, but in the periphery, we have the various other pandemics like COVID-19, and across the border, there's a threat of Ebola. So I hope that our people who work in the health department and all of us should be aware and be ready to fight against these pandemics, and more particularly is the scourge of the AIDS pandemic. I commend the work that globally is being undertaken nationally, and in Siaya, we are going to play our role. And our role as Siaya County government must include putting resources to ensure that our health facilities, our people on the ground have the skills and tools to fight against the AIDS pandemic. I want to say that we must continue with the campaign for sensitization, because without awareness and information, it is going to be impossible to eliminate the AIDS pandemic. I hope that next year, when we hold a similar event, and that will be the 35th World AIDS Day, we may gladly or happily report that we have gone 2 digits, or hopefully 4 or 5 digits down, to achieve a single-digit prevalence rate. And I think that can be done.
We are currently facing a new challenge of teenage pregnancies, increasing new HIV infections, and sexual and gender-based violence confronting our adolescents. As a county, we have achieved enormous results in HIV control over the years. The trend of new HIV infection has decreased to 14% across the sub-counties, which has resulted into the decrease of the prevalence rate from 24.8% in 2016 to 14.7% in 2022, that is this year. The county has also allocated resources, thank you, sir, towards human resource health and commodities to ensure efficiencies in service delivery.